our first speaker today, Dr. Krishna sir. Dr. Krishna Eraguntla is currently working as professor at the College of Applied Medical Sciences, King Khalid University, APA, Kingdom of Saudi Arabia. Graduated from All India Institute of Speech and Hearing, Mysore, in 1991 and later obtained Ph.D. from Manipal Hospital. Sorry for the interruption. Manipal University, Manipal Academy of Recording Program. Yeah. Manipal Academy of Higher Education in 2009. Obtained Clinical Competence Certificate in the year 1997. Third's professional career spanned over 34 years, including hospitals, schools, dispensing centers, and training institutes. Dr. Krishna sir held different positions as Secretary, Treasurer, and President of the Indian Speech and Hearing Association. Prior to moving to the Kingdom of Saudi Arabia, Dr. Krishna served as a Professor and Associate Dean of Manipal College of Health Professions, Manipal. Sir holds immense experience in clinical, academic, research, and administrative experience. Dr. Krishna sir served as an expert committee member in academic boards of various universities and the Rehabilitation Council of India. Dr. Krishna also mentored 4 students as part of the STEP program of ASHA and guided students for their PhD. We welcome you to today's webinar, sir. Looking forward for your valuable inputs.
Thank you, Harika, for the introduction. I'll just show my video for a couple of times so that people are aware of my face, whom you're listening to, before I share the screen and keep the presentation going on. As Harika said, I request all of the audience to make sure that you mute your microphones so that it doesn't disrupt our lecture. And those of you who are having questions, please do not hesitate in posting the questions in your chat box. We will see them. If appropriate, I'll try to answer them immediately. If not, I will answer them at the end of the things. And during the question and answer session, fine, it's good to raise your hand and then we go ahead. So I hope all of you are seeing my screen.
Yes, sir, it is visible.
And I'm audible also.
Yes,
okay.
Sir.
Yes, let me just do some more housekeeping. So I'll just take off the video so that we'll have a better presentation, connectivity to everybody. Okay, so today's topic, tinnitus, out-of-box thinking. Something looks odd, isn't it? But let's see, first understand what we're talking about. Okay. Now, before I start my lecture, I just would like to tell everybody that the views which I'm expressing are my own thoughts, which have come through my experience and interpretation of the results, interpretation of the information that I have studied. I also acknowledge the authors whom I have referred to, and I don't have any financial or non-financial benefit. Now, before starting, I just would like, I remind this story. Most of you must have heard about this story, Blind Man and Elephant. For me, tinnitus looks like an elephant, which is invisible to the blind people. Of course, since we are not blind, we are all, educated experts in the areas. We'll consider that we are visible, but elephant is invisible. which is equivalent to tinnitus. And each one of us, when we look at it, it looks is different as the expressions that have been shown. A medical person, ENT, looks at it as a different way, an audiologist looks at different way, a psychologist looks at a different way, and like that. So here, I just wanted to bring your attention to these questions which I'm showing. I don't know whether I'll be able to post these questions in the chat. Let me try and see if I can post these questions in the chat to get the responses, or is the responses disabled? Moderator, can you just let me know if the people can respond to any questions, or can they not?
Yes, sir, they can respond.
They can respond. So let's just try to post this question here. Copy. How do I post?
Sir, I can type it in the chat box and
yes, can you please type it?
Sure, sir. Yes.
And please, you can say yes or no question. Okay. Poll question would be a better one here. If we make it as a poll.
Sucharitha, can we create a poll right now?
I have given access to everyone
To respond in the chat box.
Yeah.
So sir has asked to respond in just yes or no.
Okay, I can see the responses coming as no, it's not a disease symptom. Okay, so many of us, I think, are clear that it is not a disease. That's very good. So let me just take another question and post it. I'm posting it. Now, can tinnitus?
Yeah, I have posted questions.
Yes. So let's look at this, how the responses are. If etiology is clear, it is curable. Okay. Yes, no. No, not cured totally. So there are mixed responses coming. Some say yes, some say no, some say it's not always. So there's mixed, experiences that each one of us have experienced it. Let's look at the last question and see how the responses is. Is there a one treatment management option for tinnitus? There's no one treatment. Yes, yes. So here majority are saying no, and only just one or two are saying yes. So that's something interesting, where I think most of us are clear, on the tinnitus being as a symptom, tinnitus that may or may not be cured based on the etiology, and there is no one treatment management, which is very good. This makes my job easier also in going through the next half an hour to 40 minutes through the lecture. Let's first try to set a stage on what we are talking about. This is something which you are all familiar. The basic definitions of it. There are numerous definitions that come across in the literature. Commonly that we agree upon is tinnitus, which is a symptom which is frequently reported in patients with hearing loss. There are, yeah. There are
somebody's mic was on.
There are people who may not have a hearing loss and have a tinnitus. There may not be any of hearing symptoms at all, purely psychological, and can have tinnitus. It can also be referred as various synonyms, okay, buzzing, humming, all these kind of a sounds. And what is interesting is this is a kind of a sensation which is only felt by the person, but not by others. The clinician can never have it. And it becomes even more bothersome when it is for a longer duration, like more than 5 minutes, or it's very frequent, coming on and off every week or every day it comes, then it becomes more bothersome. I'll Well, let's just look into the classification of tinnitus. There are various classifications that come in the literature. Here, I'm just trying to classify the tinnitus into pulsatile and non-pulsatile. The reference for this are given you below the slide, which is there. People who are interested can look for more details in that. There are other classifications also, which I'll be referring to through my lecture. But this I felt it's more explanatory and gives a lot of information. I'm not going to go through each of it, but what I draw attention to all the participants is the tinnitus which is pulsatile or non-pulsatile. It can be continuous, non-continuous, subjective, etc. But when we are looking at a pulsatile tinnitus, when we look at synchronous, non-synchronous, then we have vascular and mechanical, and there are list of diseases that can be there, or problematic various health conditions that can be seen. Now these are the one which I think we should be looking at it or keep in mind when we see a patient. Why I'm saying that is, when we are taking the history, the moment the person says the tinnitus, immediately it should flash to us. The next question is what type of tinnitus it is, and have these subcategories which can help us, let me just see if I can get, yeah, can you see my cursor? I hope you can get my cursor.
Yes, sir.
Okay, so we can look at whether it is a pulse which shows vascular and this kind of systematic hypertension or vascular tumors or kind of a things, and this. So when we ask questions to the patient, we will be able to narrow down our causative factors. Sometimes we may end up where we may not get any known cause also. There is also possibilities, but at least we will be able to identify the most probable cause by going through these classifications in keeping in mind. Now, moving on further, we'll just look at there is something, all these drawings which have come in. Let me just delete it, maybe disturbing for the other slides. Yes. Okay. So there are numerous management, as all of you felt. I'm not going to go into details of this management because this will be beyond the scope of this presentation. But let's just have the names revised. What are the different treatment modalities that are available, like sound therapy, photobiomodulation, magnetic stimulation, electrical stimulation, okay, nerve block drugs, EMDR, okay, which is eye movement desensitization and reprocessing, bimodal neurostimulation, transcutaneous electrical stimulation, transcutaneous direct brain stimulation, promontory, cochlear implant, and auditory brain stimulant. As you can see, there are some surgical intervention here, non-surgical methods which are there, which help in treatment and management of tinnitus. Some, yes, you can get complete cure, as it's believed, where if you are able to identify the exact causative factor and we are sure that it's because of that, then yes, you remove the cause, the tinnitus can go. When we don't identify the cause and we only suspect these are the possible reasons, then yes, we are going to have a confusion and we will not be able to identify that. What I felt very useful generally is whenever I'm having a confusion, I go back onto the literature, and currently you can find a lot of information in the literature which are in favor of and against any particular therapy technique, or be it as an assessment technique. But what recently, there's a lot of publications that are coming on a systematic reviews with meta-analysis. I feel that these are going to have a real benefit for a clinician in choosing a right, appropriate, and evidence-based treatment protocols, or be it assessment protocol in your time management. So in your clinic, when you are stuck, you listed, you are clear about the causative factors, you found the information, you are narrowed down everything. You are expert in that particular therapy technique, but you just wanted, not sure whether it will work out or not. Then you can reach out to these kind of literatures on the systematic review literature, which can help you to decide which has a better evidences, or which has better results, outcomes, so that there is a high possibility that when you use that kind of a treatment protocol, there is a possibility of getting a better results. So if you look at this systematic review that is published in one of the journals very recently in 2022, they have done a good review on various protocols, intervention protocols, as you can see on the screen. Transcranial magnetic stimulation are there and all this. Now, the risk of bias also is given, and they also have given the what kind of evidences are seen, okay, conclusions of those studies. Now, if you look at here, low bias of this one, so that means it's more likely like this is a good one. We don't have its clinician bias or, the claimed bias, any other parameters. Those are not going to influence you. But if you see the conclusion, there's a limited evidence which is there favorable to TMS. So you may or may not get it. But I've seen this transcranial magnetic stimulation method coming in the aphasic treatment also, which have shown some good positive results. So this is an upcoming technique which is coming. Probably depends upon the amount of stimulation that we are looking at it. Probably in future with the better protocols, it may come up as a good treatment, but there's something it's reserved for now. If you look at cognitive behavioral therapy, okay, you can see very clear conclusion that lack of evidence for tinnitus improvement. However, there's a good improvement on depression and quality of life. Now, some of the audience may disagree on this, saying that no, there is a good improvement. This is based on the literature they have reviewed. Okay, they have reviewed. As you can see, there is good number of people that they have looked at it. The sample size is good. So in most of the situations, this is what we can conclude it. But yes, we have to take with a pinch of salt. It's not that they are the ultimate one. Tinnitus retraining therapy, if you see, there's a limited evidence, and if you look at cognitive behavior therapy, there's also limited evidence, however, there's a good quality of life improvement for almost 6 to 12. So when you look at the duration, you can see that, if a patient comes to you and you're doing a cognitive behavior therapy for 1 month and then say there is no improvement or there is no change in his lifestyle or he is not at all getting benefit, then yes, you may not get it, because there's definitely that literature shows that it requires a longer duration. So there's a lot of factors which are dependent on all these things. So this is only a kind of a torchlight for you, or a guidance for you in narrowing down which protocol you want to go, or whichever protocol has a better evidence or better improvement is one you can choose it. Now, this is what I think which made us to get into this topic, out of the box thinking, because we are all confused. Okay, most of the clinicians, some of the clinicians are very clear, okay, who are trained in a particular technique, who believe that technique will benefit the patient. For them, they are very clear. Even the assessment also, they are very clear. They just choose 1, 2, 3 and they do it. But there are young clinicians, or who are initial days of their career. They may come into this scenario of getting stuck. Which one to choose? Whether to choose this or whether to choose that? Whether should I go for this protocol or should I go to that protocol? So this kind of a confusion, which many of us can end up. So generally, I feel if you get, whenever you get stuck, there's always good to review certain questions like this. History, some of us may or may not get stuck, because most of us get access to some of the case history sheets that are available during your training or after that. You will be able to go through the history and then get most of the information. Routine tests also, most of us may not get stuck, because just doing routine P-tone audiometry, impedance audiometry, reflexes, photoacoustic emissions, ABR, these are something routine which will give you a majority of the information. When you look at doing any special test, probably you may get stuck. Which one to choose? Whether should I choose a test to confirm the cochlear pathology, whether to choose a test to confirm a retrocochlear pathology, if a retrocochlear pathology will give us any information. So in choosing of the special test, most of the time the confusion is always there. And interpretation of results, yes, may not be, many of us may not, because most of us have got adequate training, if not excellent training, definitely adequate training for us to interpret it. And this is something which will come over a period of time if you have to combine your results. Causative factor, yes, as an audiologist or any clinician, we may get stuck, because sometimes it's very clear, sometimes you don't know, sometimes you suspect. So this is something. Now, is it essential that we have to find a causative factor? Now, this is a problem that a person is facing. Now, is it essential? Now, in treatment protocols, if you find a causative factor, you can do a better management. Even if you have to give some, refer to a medical management, if there is a clear cause, then a good outcome treatment can be given. When it comes to the selection management, that's what varies with the management options. You also get stuck which one to choose, or you may go in a trial and error method and feel, okay, this I tried, that I tried, and we may be may or may not be successful, and you may get stuck. Now, this is what is the question is, if one technique you tried, then what? If it doesn't work, if it works, you are happy, patient also is happy, you are also happy. But if it doesn't work, that becomes the biggest question mark. Now, that's the way we need to think out of the box. Okay. Now, what do you mean by the out of box thinking? It's not like, your brain is a box and out of box. Okay. So I'm just giving, for the benefit of audience, I'm just giving the definition which goes in the literature, where whenever we think away from the directions, or we think in a diverging directions, in different, not a routine way of thinking, but we think in a different directions, then we may come up with novel ideas or solutions. We may say, okay, this may work or this may not work, or why don't I try that, why don't I try this, kind of options will come. There will be an hesitation, okay, this was not taught to us, but is it okay to do it? As long as it doesn't harm the patient, as long as you think that it can benefit the patient, and you see the over a period of time, you see that there is some benefit coming. There's nothing wrong in trying it. Okay. But when we look at scientific perspective, there's a need for any evidence for anything. So that's something which I will talk about later, how to build up those kind of an evidences. But these are some untested methods that you can come up based on your practice, based on the scenario in which you're working, based on the patient that you are dealing with. So this is where we need to get your out of the box thinking. So to proceed into that, how do we go about it? It's easy to say, okay, think diversely, think that, think this. But how do you think? I'm giving you some leads where you can probably start in that direction. Is in your case history. I feel this is one of the first steps that we can make our diverge thinking. When a patient comes in most of the clinics with a lack of time or with the number of patients that you are seeing or various reasons, you may end up in not taking an extensive case history. You may just ask a couple of questions that are relevant to the problem and then proceed to the testing and then start some management. And even some contribution from the patient also may be there because they also don't want to spend much time on it because for various reasons. Now, as long as in your first shot everything goes on well, it's okay. Patient is also happy or not. But when the patient comes back or you don't find any improvement in the patient, then is the time where you need to be looking at it. To save time, it may be a good idea to collect the information before only. Okay, some of the questionnaires which I've given you here, which you may all be familiar with, okay, which hope I will be able to show that to you, okay. Like this tinnitus questionnaires which are there. These are freely available questionnaires. You can see how extensive it is. Now, these are something which will take time, where you may have to reschedule the patient for a complete relooking into it when they don't improve, or if the patient is coming from a doctor's shopping. They have been visiting many people, they got frustrated, and they are coming to you again, then probably see how extensive the history information. Then I'm not going to go through that. So this is available. This also I would recommend everybody to give in the first time, to understand how much is really its handicap to the person. If it is really handicapped to the person, then is the time where there needs to be seriously thinking on the management, what type of management. If they are not really very serious about it, then probably you may not, the patient also may not be serious on implementing your suggestions. A person who is really affected will implement whatever suggestions you give it. So this also will give you an idea of planning your both management and follow-up on in long-term nature. So these kind of W questions, what is the bother? What is exactly bothering? Is it tinnitus? Is something else? Now, these are some of the questions which will help us to understand if there is any psychological issues behind them also. Okay. At the outset, first they may say only tinnitus, but probably when you start probing them, the real scenarios can come up. Then when is it more or when is it less? When the tinnitus is more. This most of us will be thinking, they will be asking it, but what I'm looking is when you want to look at differently, I'm not sure whether it will be appropriate or not, but there are like situations, where you might all observed that, or you must have heard somewhere or the other, the environment in the earth is influenced a lot by the moon cycle, okay, the full moon and new moon time. full moon time or new moon time, the best reflection is on the sea waves, where the waves are high tide and low tides. Some of you who are near to the sea will be knowing that better. But even otherwise also you must have heard. So this is always happening because of your electromagnetic, the magnetic field which is there between the moon and earth, which are changing, geomagnetic fields. So those are causing you these changes. So probably some kind of influence will always be on human beings also, which some has been reported, like psychological problems have been increased with the moon cycle. So you can try to probe in and see if there is any kind of situation like that which is causing, not just morning, evening, or when I go to office when I'm more stressful or anything, but you also can look at these other where situations there is an increase and decrease it. Then where do you think the problem is? Now this may think, some of you may think that this is the question to be answered by a clinician. Why should a patient look at it? Some scenarios, patient is a experienced patient is a better clinician also. Okay. So they know better, what exactly is. So why? Because when he or she is suffering for a long time, for years, they would have seen within their body which part of the system is really troubling them. So that's probably can give you the clue, and for us to probe into and see if that is any contributing factor. The patient may not be right, but still you can try and probe into that. You can also look and see if how did you get this problem, now, this may be some of the times when it is linked with psychological issues. They may say, as soon as I got married, I got it. Or as I had children, I got it. Or I went into a different house, I got it. So these kind of questions that, answers that you will get it. So these things will help us to identify if there is any psychological issues that are there. Who do you think can solve the problem? This is again an interesting one, which why I'm trying to ask, you should ask is, some of the patients are biased to a particular professions. Okay, they feel that if they go only there, they get it. Now, when they have that confidence in them that yes, this particular person can cure or can help him to overcome the disease, that itself is a half treatment. If he comes with a half-hearted and he is just trying out with you to solve his problem, then whatever best you do also may not be successful. So this is, to gain the confidence of the patient, or for the patient to have confidence in you, this kind of a questioning can help you. It's always, there is something called a placebo effect, which is there. Sometimes if the patient trusts on a doctor, even if he gives a medicine that is not relevant, having no medicinal value also, he takes that medicine and he feels he is very happy. Okay, so this kind of understanding of that placebo effect, this kind of questions can help. How much time and effort can they put in solve problem? This is again something that I feel which is important is, yes, it is bothering, but they don't have time. Especially current days with so many multitasking and busy life, travel time, work pressures, and so many effort. Now, if they cannot put an effort to solve the problem, and they want something like just like a click of a button, things should solved, may not be possible in all the cases. When we know the clear cause, yes, it may be possible, but there are many situations where it may not be possible and there is a conscious effort of the patient. So that's the time where you should definitely look at this answer and see whether the patient is really interested in solving his problem or not. You may think when he is coming to consult a doctor, definitely he is serious. Yes, he may be serious, but whether he is really ready to put an effort. Because some of the alternative strategies which are there in the literature, one needs to spend time for that to overcome. Now let's another major area is assessment. Why I've given a little of importance to the assessment is this will help us to identify the causative factor or the source, or to understand which part of the auditory pathway is affected, or even before that to understand whether it is auditory or non-auditory. If it is auditory related, yes, you can help it as an audiologist. If it is non-auditory origin, then it's good that you refer to the appropriate professionals one, because that will be very useful. Sometimes it can be due to multiple reasons also. They maybe have overlapping. It may be because of auditory and other non-auditory causes also. So whenever we have these non-auditory related causes, it's always good to refer to other professionals, which you all must be doing it also. Most commonly, most of the time, we refer to the ENT or a psychologist, but you should also be looking at other professionals like neurologists and others, which can help you to get information. And it's in private practice and also in most of the setups. This is the question which is, you need to spend a lot of time, some time on it. It's not the evaluation that you choose, but to choose the evaluation that can give you the information. Now you have a routine evaluations. Now what additional evaluation will help me to identify the which suspected auditory pathway? I hope you are able to understand that, because we have list of things, list of evaluations. You've got various things at each level of it. It may not be possible for the time and financial issues to do all the evaluations. So it may be a good idea to spend some time for us on this to choose the right evaluation. And if that evaluation can help you to understand the patient's problem. If it doesn't, then it's good. No need to do any further evaluations. Be happy with whatever is things are there. Okay. And also that's what when you can come to conclusion of this evaluation is when you are able to get some information that's relevant from the existing results. Okay. We say sensory neural, okay, sensory loss or a neural loss. If it is a sensory, whether it is cochlear related that is causing you a problem, what evaluations can help you to do it? Neural, yes, what kind of a thing will help you? Then you can also look at, like the special interest groups which are there, literature support, talking to the experts, which again, these most of us does it. Okay, we always, whenever you may have your close buddy who is better than you, okay, in that particular area. So, or you post it in a group like now most of us does. There is a ISHA's platform, clinical audiology group, which is there, and people do post their issues there. And people, there is a diverse expertise which is available, and people post their answers for their questions based on their experiences and guide the young clinicians or even experienced clinicians in deciding whether the evaluation or the management options. Now, having talked about all this, let's try to look at some of the case examples, which I'm happy that the organizers have shared some of the case examples who had tinnitus, which can help me to go through what we have been talking about, out of the box thinking or diverse thinking that we should be planning to do it. Now, these are the audiological evaluation results shared for a 72 years female. So, look at the age and the gender. Okay, age and gender, which should spark some kind of ideas. What are the possible things? Yes, if you look at pure tone audiometry, it's look straightforward. Don't look at any mistakes if they are there. Okay, so we are not looking at critically evaluating the evaluation part of it. Okay, we are looking at the concept of it here. So this lady seems to be having a sensory neural hearing loss, and there is a bilateral also. Middle ear seems to be fine. There's a type A tympanogram. There's not much of a middle ear issue. The tinnitus related information what was obtained is tinnitus is in both ears, that's continuous, okay, and the tinnitus matching was done at 4 kilohertz and 55 dB, okay. Now, those of you who are into the system of tinnitus management can post answers to these questions, like what information is missing, what can you do, what you cannot do, what could be possible reasons. Based on your experiences levels, you can be posting. Let me see what kind of responses that you are able to give it. Okay. Do you feel that the information what is given is sufficient enough? I'll just give for a minute to think on these lines before I proceed further. Okay. So those of you who have already the experiences or who are have a knowledge, what do you think? What information do you think is missing in this case scenario, in this case? And what can you do and what you cannot do? Test of residual inhibition. Okay. All of you can get, this is where the good interaction can happen and good thought process can happen. And this is what is the divergent thinking. Okay. Onset and nature of tinnitus, so that goes to the history and medical history also to understand if there are any other medical problems are there. So this couple of hands making masking effect is present or no. Okay. So this is again your evaluation part of it. You are looking at it with inhibition and masking. You are looking at the evaluation information. Okay, you are looking at the history. So this is what I have talked about. Okay, so if you are clear, if you are having sufficient information in your assessment and your evaluation, most of the time your outcomes, your choosing of your treatment and outcomes are much better. I don't see anything more coming in. So what could be possible reason? Any answers, any takers there? What could be the possible reasons? Anybody can say? Age-related hearing loss, presbycusis, yes. Noise-induced as sloping pattern, NIHL, yes, good number have come. Let's look into what I have it to share with. Okay, let me just take back you to the tinnitus classification which is there. Okay, which can help us not using hearing aids in so many years. Okay, the person was not using, not sure. Okay, we don't have that history whether he is using hearing aids or not. But if you look, the causative factor, okay, so it's a continuous tinnitus, okay, considering that it's let's not look at pulsate or non-pulsate, but let's look thinking that it's a continuous. There is a bilateral hearing loss and there is a probably normal otoscopy findings, which we don't have that information. So these are the possible reasons that are there. Now with the results available, with the age factor, so presbycusis could be the most probable causative factor which is there. Now with this causative factor, identifying, there's a significant hearing loss and it's a continuous tinnitus also. The patient should get benefit with amplification and with a good amplification that is there. Now what clinician probably can consider additionally is probably hearing instruments with masker also, not just the amplification device, with masker. Here since they are having a clear tone frequency, that kind of a masker can help it. But if sometimes you may not be able to do a tinnitus matching. Now at those situations, even just an amplification may be adequate enough to overcome it. Now, if the patient is not able to overcome that, then is the time where we have to relook into other situations. Now look at this another case scenario, and then I will be concluding after this. Now here we can see that this is a 39-year-old female who is there, who has almost like a normal hearing. There's not a significant hearing loss that, unlike the last patient. Tinnitus is bothering more in the right ear, and it's occasional and it's verbal. Okay, it's a ringing tone. TIMPS is normal. There's no any significant. But if you compare TIMPS, especially in the right ear, the compliance is not as good as the left ear. So the tinnitus is also there in the right ear. Okay, tinnitus is in the right ear. There's a little bit of low compliance. There's a little bit of conductive gap which is there in this, considering that this is a very reliable or consistent audiogram that has come in the subsequent evaluations also. So if you take all this, there must be some kind of a middle ear pathology also that be contributing. So again, I pose these questions: what information is missing here? What can we do? What we cannot do? What is the possible reason? Any answers from the audience can help the young clinicians who are there on thinking diversely, okay, with the topic what we are looking at it. So ETF function test can be beneficial. Yes, it can help because to see if there is any eustachian tube dysfunction that can cause only what cannot go along with eustachian tube is it's not the kind of a pulsatile kind of a thing, though pulsatile is generally going with the glomus jugular tumors or those kind of a thing. Or, this is, eustachian tube dysfunctions can cause you those kind of a symptoms. It's a pure ringing tone, so there are very less chances, okay, but still it's a good test that we can do it, okay. Any other suggestions? And what could be the possible reasons? Nothing is coming in. Okay. I'm not sure is ringing tone in both ears or unilateral. They said it's a unilateral. It's clearly mentioned that it's in the right ear, unilateral. So that is probably, further history can help us to understand if there is any middle ear pathologies or, getting recurrent URTIs can help us. Okay, so that was something related to the earlier one. So anyway, so if nothing much coming in, let me just proceed on because I think we need to look at the time also. So again, I go back to the classification. This is what I'm showing here is a different classification which is available in the literature where we can classify based on subjective or objective. Now, when it is subjective and there is a no hearing loss, okay, then there are possibilities of psychogenic and metabolic. If our suspicion of middle ear doesn't work out, then there is a need for us to look into psychogenic or metabolic considering the age of the patient. Okay, it's a 39-year-old female who will be undergoing through a lot of familial stress and her one body changes that can happen. So these things, is also something that we should be looking at it based on the age and gender of the individual thing. So this is how, it will help us, as you can see, based on this, how we need to probably probe into other aspects when we get stuck. If you look at the management, most of the techniques are on either attention diversion or they are related to masking or behavior modification, cognitive training, medications or dietary. Any of the techniques that we are adapting it are using these principles. Now let's look at diverse thinking in Indian context. Now, when we look at bhajans, these are something which, most of the places will be happening. It. Now, if a person has a high frequency tinnitus, okay, how about considering bhajans where they do, and especially with the tala? And when they have a low frequencies where they participate in the bhajans in the drum. Now here when they are doing bhajans, their attention diversion is done, masking is done, and there's a cognitive load also that will happen. So which can probably influence the tinnitus and overcoming the tinnitus. Similarly, if you look at yoga, the yogic exercises which are there will generally help in the blood circulation increase and your better control on your cognitive and attention, which will also, influence your behavior modification with the yoga. So we are targeting again either one or more principles that most of the established techniques that are there. This is another one, pravachanas or lectures, where when suppose you are involved in listening to spiritual leaders or anybody, okay. Now your mind and soul should be concentrating on that. Then only you will be able to. You go to pravachana and then your attention is diverted, then yes, you may not be. Okay. In our society, we have this family and social gatherings, generally for the festivals, how things happen. These are also good occasions that we can make use of it to achieve this. Whenever there is a social gathering, lot of people talk and there is a good masking effect. Irrespective, we can have a multi-frequency masking. There is a lot of noise, music, everything going on. So there's a good masking, there's a good attention, good cognitive load because you try to meet so many people, your relatives whom you have seen rarely also. So now why these things is most of the time you see tinnitus patients who are little advanced, who are really affected, avoid these gatherings. Okay, avoid, so they try to be away. So by you suggesting that, you are trying to achieve this. Now alternate medicine. Okay, my another faculty today, Abhinayasri, will be talking about. I will not touch matter, but one can look at it like homeopathy, naturopathy, Ayurvedic, which are having dietary modifications also can help, which there is evidences that are coming. Okay, so to conclude, I would say that we need to give importance. Initially, you may not, but when you get stuck, when you want to do out of the box thinking, yes, look at it. At that time, to save your time and to, keep your clinic running also, you need money. So that's good to have a separate appointment rather than, continue the appointment and make other patients wait. Evaluations, yes, you may not be able to invest entire protocol, all the evaluations sometimes. Do what best you can do it. Sometimes try to refer to your colleagues or nearby other setups who have it. If nothing is there, try to get a logical thinking and see where you are, what information you have it. Choose appropriate techniques, which is very important. Don't just randomly do it. Okay. And if not successful, is where you are thinking out of the box, either by discussing by yourself or by expert group people. Now, with that caution, you try to logically think first, because always you may not be having a straightforward answer, but you see if it correlates with the history and what findings you are able to. Now, these are the something when you do out of the box thinking, I would suggest all the people to make sure that you record and systematically collect the information and document it. Now, by that, you are trying to generate evidence, at least to yourself, if not for the scientific community, which can later on, probably, if you try to repeat the same thing on a couple of patients, probably you may become an inventor for a new technique. And what evidences you have collected can be as a proof for us, and then say, yes, you have done something, evidence-based practice, and this is a new technique, and you can be the author of that new technique. So with that, I conclude. I hope I have concluded within the time. and we have some 5-10 minutes for our question and answer sessions.
Yes, sir. Thank you for the insightful and interactive session. It is wonderful listening to you. And to summarize the session, we have highlighted on evidence-based management strategies of tinnitus, and you have also highlighted on the holistic approach, which needs to be taken by all the professionals. And you have practically explained with case studies, which help to carry out the knowledge which we have learned now. And one interesting thing which I 100% agree is like giving the responsibility to the client, because at the end of the day they are the one who has to take a call whether they want the treatment to work or not. So that subconscious thinking is something you have highlighted in the case history. So thank you so much, and thank you for your patience and bearing with the technical glitches which happened in the beginning of the webinar. And now the session is open for Q&A. Participants can raise your hand to ask your questions. So any questions from the participants?
Good. There are no questions. It makes my life also easy. Looks like clear.
So one particular comment we had at the beginning of the session is from Srividya A. Treatment efficacy depends on several factors from review to like type of study, participant demography, geographical areas, test done, duration of treatment, etc. So would you like to comment on that, sir?
Exactly, that's what I was telling it also when your outcomes, when you are looking at it. First thing is your history, definitely a lot of information is hidden there. And most of the time, due to various reasons, one may blame time, one may blame on knowledge, one blame on this, but due to various reasons, we may not have a sufficient history, but when you have that history, it will definitely help us in a better outcomes. Next is, yes, the place in which you are living, the demographic details which are there, and the technique because some techniques are not really useful in certain individuals, definitely not. Now here I just wanted to, I was thinking the sound therapy which is there, which quite popularly also is there. Now the sound therapy, what we have it in our context, when we look at giving a pure tones in a sound treated booth, some individuals may not really be happy with that. What is that? Because the booth itself can create an anxiousness and the tones are not meaningful. But you alternate with that with these kind of music, our bhajans or any of those things, it can probably have an influence. Of course, these are not tested one. Okay, we don't have evidence on it. But as I was telling in my last slide, if you can build up as a evidences, and you can probably, there's a lot of work going on music therapy, how it can affect on health. Mysore JSS, not JSS, Datta Ashram, Mysore Datta Ashram, they have done a lot of work on music related and these outcomes of those things in various conditions. There's some question. What's your experience?
What's your experience with psychogenic tinnitus in presbycusis patient? How do we handle other than hearing aid prescription?
Yeah, now I'm here really interested on presbycusis patient. When we say presbycusis patient, that means it's a elderly people. Okay, so elderly people are really hard to handle because in front of them you are a very young person. The mindset what generally believes, that's what is the question which I was telling, where are you confident on me? On whom are you confident with? So building up this patient and clinician relationships is a very good. It's not that all old people don't have a trust on youngsters. Okay, they have their own grandchildren also. They have their own children of your age group, maybe there. So you need to develop that rapport in handling these elderly patients. Once they have a trust on you, their half of the disease is gone. Most of the time, in most of the individuals, it's the attention that they are lacking that makes them get into these psychogenic problems. It's not the disease as such which really gets into. In most family situations, the children are busy in studying, or their children are busy in working, so they don't have people to talk with. So they get that isolation things comes into their mind, so that bothers them a lot. And even if you give the excellent hearing aid, they may just in front of you, they may put the hearing aid, but after that they put under the pillow or in a cupboard. They will definitely say this doesn't work with me. But I have seen definitely with the elderly patient, I know the hearing aid was not giving a benefit, but when I kept and then talked to them, the trust they had, it made them comfortable, and they did comment that when I am in the clinic with you talking, I can understand, but when I go to the house, I am not understanding. That's a clear indication that the patient is getting benefit, but it's the environment that. So there, instead of patient, it's the family members that needs a better attention. Okay, where you need to work with the family members on how their behavior has to change rather than that elderly person. So again here, when we understand the history, when we understand these relationships, we can do a better management. I hope that makes it a little clear.
Yes. So I think that's all the questions. Right. So thank you so much. So now I'd like to take your permission to proceed to the next session of today's webinar.
And thank you for all the Andhra Association committee members for inviting me for this and sharing my thoughts. Doing a good job. Keep it up, and we look forward that our Andhra Association. I am also from Andhra. I could have been happy to speak in Telugu. I know, but because this is diverse audience and a platform in a diverse audience, we need to use a common language, English or Hindi. But I would have been very happy to talk in Telugu. I am also from Andhra. So seeing such activities going in our state is something very happy. Thank you, everyone.
It's a pleasure to have you here, sir. So we have heard, I personally have heard a lot about you. I have met you also in ISHACon, and this is the first time I got to listen to you, and it's really good.
Okay. Thank you.
Thank you. So, I'd like to move on to the next speaker. So we have Dr. Abhinayasri, BNYS, Bachelor of Naturopathy and Yogic Sciences. Dr. Abhinaya has completed her bachelor's at Sri Dharmasthala Manjanadeshwara College of Naturopathy and Yogic Sciences. She has worked for a year as a medical officer at Dr. Mantana Satyanarayana Raju Arogyalayam, Vijayawada, followed by 3 years of experience at the Center for Integrated Medicine, Hyderabad. She also worked as an on-call nutritionist for a year at Stepping Stone Speech and Hearing, Kakinada. Dr. Abhinaya, we welcome you to today's webinar. So we can get started with your session.
Thank you, Harika Garu, for taking time to introduce me. It's an honor to me to, just a minute. Sorry, there is an issue with my laptop. Okay. Yeah. It's an honor to be a speaker along with Krishna, sir. I'm honored to be speaking here about naturopathy medicine, which we can combine with conventional medicine. So, good evening, everyone. So, I'll be here. Just a minute, I'll share this screen. Ma'am, is it okay?
Yeah, it is visible, ma'am.
Yeah.
Okay, thank you, ma'am. Okay, so I'm here to present on a topic called integrated tinnitus care. That is nothing but combining naturopathy with conventional medicine for optimal relief. So, as we all know, like Krishna Garu almost covered everything in detail. So, as we all know, tinnitus is a very difficult condition that not only affects the individual quality of life, but it also affects the mental and emotional well-being. So, when we combine conventional medicine and naturopathy together, we can give like we can improve the yeah. Sorry.
You can continue.
Okay.
Somebody's microphone was on. I request all the participants to mute your microphone.
So yeah, when we combine these two systems, we can enhance the overall treatment outcome and improve the patient satisfaction. So yeah, today I'll discuss about the role of nutrition, lifestyle modification, stress management, and mind-body therapies, which may decrease the symptoms of tinnitus. So yeah, I'll give you practical tips which you can incorporate in your like daily practice. So yeah, let's just quickly go into detail. Okay. So if you see how our ears process the sound waves, you already know everything about it, and Krishna Gar already covered about it. So I'm not going into I'm not taking much time on this. Our ears process the sound wave like first. Sorry. Okay. So sound waves are first taken by the outer ear, which travels to the ear canal, and then to the inner ear, and then it changes into electrical impulse with the hair follicles, and then these auditory nerves take this information to the brain stem, and from there to the brain, which we already know. So now, if we see if there is any damage in any part of this pathway, it may lead to tinnitus. Okay, let's see that in detail when we go into the causes. Okay, so sadly, tinnitus is a very frustrating and irritating condition where patient may not feel the real silence. Like when silence isn't silent anymore. Patient will be suffering a lot. They slowly develop depression, anxiety, and slowly they get suicidal thoughts. So let us just see a quick video on it, like how it's just a 1-minute video, so that we can see the patient's perspective. So for us, when patient is complaining about tinnitus, yeah, it may be easy to suggest do that, do this, take this treatment, keep this hearing aid. But for them, it is a continuous problem which is irritating. Well, sleep also, they may be not getting good sleep as well. So yeah, okay. Coming into the topic, if we see few causes of the tinnitus, if there is any obstruction in the ear canal because of accumulation of earwax, or if there is any foreign object stuck over there, it may lead to tinnitus again, because the sound waves may not pass easily. And if there is any over usage of medications like antidepressant, loop diuretics, that may again lead to tinnitus because of the nerve damage, etc. Then few nutrient deficiencies like vitamin B12, zinc, magnesium, These may lead to tinnitus again. Then if there is any head or neck trauma, like if there is any damage to neck muscles or the nerves in and around the head, it may lead to tinnitus again. Age also plays a very major role because of the oxidative stress and lifestyle. If the person is exposed to loud noise, or if the person is a musician, or if he is working in any military area, that may again be a cause of tinnitus. So other medical causes are already sir have covered everything. So I'm just brushing it up again. So other medical causes are viral and bacterial infections, Meniere's disease, temporomandibular joint disorder, anxiety, depression. See here, anxiety and depression is like a cycle. See, because of anxiety, patient may get tinnitus, or if patient have tinnitus, it may lead to anxiety and depression. You got the point, right? So it's like a cycle. And high blood pressure also may be the cause of tinnitus, and autoimmune conditions are also the cause of diseases. So we are addressing all this, like overall, what we can do in naturopathy. First, for what will be the first line of treatment, like every audiologist do, what they do is, what we suggest in general is ignore tinnitus sound. But if there is something constantly irritating us, like not the patient, if something is irritating us, like if for example, if mosquito is biting us continuously, can we ignore it? No, right? Same thing is happening there also. So there is a continuous irritating sound in your ear. If you ask the patient to ignore it, it is difficult for them. So what are the other options are like hearing aid, tinnitus masker, masking headphones, TMJ support, medications. You will be knowing better than me here. So these are the first line of treatment. So along with this treatments, we can combine the other natural remedies or natural tips. What are they are? Sound therapy also comes under conventional medicine because sound therapy, they use a white noise, pink noise that is exposed for a constant, like for a particular period of time, so that the actual tinnitus sound will be reduced. And there is neurofeedback therapy, which is called as electrodes are placed all over the scalp to record brain activity, which is then displayed on a screen as visual feedback to the patient. So patient will be sitting and seeing the screen. So he'll know, okay, I'm getting tensed about the tinnitus, brain activity has improved. Okay, he himself consciously makes his thoughts like slowed. You understood, right? Yeah. And coming to the naturopathic point of view, same like these relaxation therapies like sound therapy or cognitive behavioral therapy, few other therapies, it is similar. Like we can include yoga, meditation, breathing exercises, etc. In this tinnitus treatment. Like how will this work is, if we combine physical activity with meditation, like physical activity in the sense, we'll suggest like few forward bendings or few asanas, like where blood flow will be increased to the upper part of the body. So when blood flow is increased to the upper part of the body, there will be oxygenated blood carried to the upper part of the body. This again may relieve the tinnitus symptoms. Sorry. So by combining physical postures, breathing techniques and meditation, we can calm the mind and body, and it reduces the tinnitus perceived symptoms. Okay, breathing exercises in particular can help regulate the nervous system. It reduces stress and promote relaxation. Meditation on the other hand can help revive the brain, reducing the emotional response on tinnitus. So there is one more technique called Yoga Nidra. So what exactly is Yoga Nidra? We ask the patient to lie down in supine position, and we ask them to slowly observe every part of his body. Like for example, starting from the toe, ankle, knee, hip joint, like that. From down, we'll go to the upper part of the body. So by the end of the session, he'll be conscious on his body, and once he's completely relaxed, we'll give him a particular scenario. Like imagine you're sitting near a waterfall, you're completely relaxed. It's similar to cognitive behavioral therapy or some other therapies which are included in this psychology. So what happens here is autonomic nervous system regulation will be happening. It reduces cortisol levels, it improves sleep, and mind-body connection will be increased because patient will be concentrating on whatever we are telling them, and they'll be very conscious on their body movements, etc. So along with yoga nidra, we can include acupuncture. Acupuncture plays a very important role here. Acupuncture is a traditional Chinese medicine where we insert few needles into the acupoints. There are few points in our body. So according to their medicine, there are 12 channels in our body, 12 meridians. So if there is any blockage in that channel, the pranic flow will be obstructed. If there is obstruction, it may lead to disease. This is according to the Chinese medicine. But according to conventional medicine also, there are few pathways. It works like there are three theories called as gate control theory, endorphin release theory, and the vagus nerve theory. So when we insert those needles in those particular points, those stimulate the nerve endings. Nerve endings are which nerve endings will be stimulated is neurokinin 1 receptor, mu opioid receptor, C fibers. This neurokinin 1 receptor is helped in the regulation of pain, and it also transmits the pain signal. C fibers also transmits the pain signals. So these will be stimulated. Then followed by there will be release of neurotransmitters. The neurotransmitters are nothing but like from one neuron to the other neuron, there will be information passed, right? So these neurotransmitters will be released. So increased blood flow and oxygenation will be done again here. To that particular acupuncture point where we have stimulated, there will be increased blood flow and oxygenation. I have mentioned these research papers. Sorry, just give me a minute. I have mentioned research papers on the end of the slide on every topic. So, so we can give this when we pick this acupuncture point, we can give this electrical stimulation for 20 to 30 minutes. It should be given for continuously for 10 days. And if required, we can repeat it again after 2 to 3 weeks. I'll show you 4 acupuncture points. For example, if patient comes to your clinic and if you are interested to do this, you can, like, if not acupuncture, you can give acupressure. You can put pressure on those particular points at least for 5 to 10 minutes. One point is where is this? Okay, right. At the end of the session, I'll show you those 4 points. Okay. So next comes nutrition. How will nutrition help in tinnitus is it helps to manage oxidative stress. Oxidative stress is mostly seen in old age people or who have autoimmune conditions. Our own cells will be damaged. So to compensate it, we can include few antioxidant rich foods. Those are spinach, walnut, beetroot, broccoli, pomegranate, carrot, red cabbage, sweet potato, and beans. You can ask your patients to take this, and you can ask them to observe, like after few weeks, if they are okay, you can ask them to continue. it depends on you. Like if you're interested, you can include all this in your treatment. So next, everyone is not ready to wait for so many weeks. Many patients want instant relief. So food will take some time to work in the body. So if we give supplements, it may help. So few supplements which we can suggest is magnesium, vitamin B12, zinc, and vitamin D. How will vitamin B12 help is it's a vitamin that's important for the circulatory and nervous system. A deficiency in vitamin B12 can cause hearing loss and tinnitus. Zinc. It's a mineral that's important for a healthy immune system, protein production, and wound healing properties. It might also protect structures in the ear that are involved in tinnitus. Magnesium is a supplement that may help reduce the severity of tinnitus symptoms. It's also been shown to help with sleep and brain health. Brain health. Sorry, I'm extremely sorry. So we can include these supplements along with our daily treatment. And hydrotherapy is the treatment which we treat with water. There are different kinds of treatments for every condition. So in tinnitus, what we can do is hot foot immersion. It should be like it's not too hot or not too warm. It should be a little more warmer. Okay. So in that water, immerse your both foot until the calf muscles, and wait until 20 to 30 minutes. And one more thing is holding mouthful of water, mouthful of neutral water, not too cold or not too hot. How will this work? See, hot foot immersion, when we put our both feet into the water, there will be vasodilatation of arteries. Your arteries will expand a little bit and there will be a free of blood flow. So it may again reduce the symptoms of tinnitus. There will be nerve stimulation in the feet and it may distract from the actual ear pain or that ringing sensation. And it increases when we put our legs in the water, there will be a sudden rush to the foot, and that sudden rush to the foot, like after some time, like after 5 minutes, again the flow will be gone back again. So the same flow will be going to the upper part of the body, which may again lead to reduction in tinnitus symptoms. Then how will holding water in the mouth help? It reduces the middle ear pressure. Like if we yawn, opening our mouth mouth widely, like when we have cold, if we yawn, you can feel a popping sound in your ear. So same thing happens when you hold water in the mouth for 2 to 3 minutes or 5 minutes. So next is fasting therapy. Fasting therapy, there are many kinds of fasting, like water fasting, juice fasting, intermittent fasting. So we can ask the patient to completely be on water for at least 1 day is more than enough. Like initially when they are ready to do fasting, water fasting for 1 day is enough. Juice fasting for 3 days we can suggest. Intermittent fasting, they can continue it up to for 1 month. There are the mechanism of action behind this fasting is it reduces the inflammation. So autoimmune conditions, it will help again, or if there is any ear infection, it will help. It increases autophagy. Again here it works for autoimmune conditions. Improve blood flow and oxygenation. Again reduces oxidative stress. Increases production of brain deprived neurotrophic factor. And then comes diet therapy. So diet therapy, and in the patient who whoever is suffering, most of the patients have this gluten allergy or casein allergy. They might be not aware of it. Gluten is present in wheat and casein is a protein which is present in milk. So if we avoid this, this allergy may sometimes trigger tinnitus symptoms. So if we avoid these gluten and casein-free products, it may reduce tinnitus symptoms again. There are many research papers on this. You can go across to it. And what are the other food that trigger tinnitus are caffeine, alcohol, sugar, salt, citrus fruits. So here many of the patients will ask, see ma'am, you're asking to avoid everything what is left to me. Then what we can suggest is, we can ask the patient to maintain a symptom diary. So when he's, when for example, if the person is having milk for at least a 1 week, then he may observe, yeah, tinnitus symptoms have increased, he's not able to sleep properly, or his gut is damaged. Then he'll note it down, yeah, milk is not good for me. Then after a week, he can start with caffeine. Okay, he feels nothing is happening with caffeine and his symptoms are also not triggered. Then he'll note it down. Okay, caffeine is okay for me. So we'll maintain a symptom diary. Severity scale is noted down. Then we should track the dietary choices. That means what he can take and what he should not take. We'll make two two lists, like what he can eat and what he cannot eat. Then identify those patterns. If, for example, in as we already told, like milk, he cannot take. So for how many days? Once if he have coffee, is it triggering? Or for 1 week continuously, if he have coffee, is it triggering? Like milk coffee, I'm telling you. So he'll note down the patterns as well. So he'll make a list out of it. Okay, if I have once, it is not triggering, and if I have continuously for 1 week, it is triggering. So this is good, but until what period it is good, like that. Next is chromotherapy. So along with this, what sound therapy or yoga nidra, we can include chromotherapy into that. So in whichever room you are giving those treatments, like those therapies, you can make that room either in blue or green. If we combine this blue or green, it may lead to calming effect. Blue, as you all know, blue is a calming effect that the blue have a shorter wavelength, so it helps to regulate the body's circadian rhythm. It reduces cortisol level, it reduces heart rate and reduces BP as well. Green balances the melatonin production. Melatonin is a sleep hormone. It balances, it balances. The morning it should not, melatonin production should decrease, and at night it should increase. So green helps in that balance. There are a few research papers I have put under every slide. You can just go through it. So in conclusion, I just want to tell you that in your daily practices, you can include this naturopathy tips so that it may help the patient. That's it.
Thank you, Dr. Abhinaya. So you have brought a completely different perspective. It is alternative medicine in management of tinnitus. So it's interesting to know about indigenous techniques like yoga nidra, fasting therapy, sound therapy. So a couple of things is the first time I'm getting to learn. And so what are your comments on JPMR?
Sorry, can you tell me in detail about it?
JPMR, Jacobson's progressive muscle relaxation.
Sorry, I don't know about it.
Oh yeah, it's similar to yoga nidra, but
okay. Sorry, can you repeat the question again?
Yeah. So any impact of JPMR, Jacobson's progressive muscle relaxation on tinnitus?
Yeah, if it is similar to yoga nidra, then yes, it will help in muscle relaxation. It will induce sleep. Yeah.
Okay. So
it reduces cortisol level, yeah, as far as I know.
I think the participants also have learned many other alternative approaches.
I hope it is useful for them.
Yeah. So okay. So the session is open for Q&A. Any participants would like to ask questions? If you're comfortable, you can type your questions in chat.
What is this? What would be the duration of treatment? Um,
Yeah, what would be
Sorry,
the duration of treatment?
I didn't get that, ma'am. Yeah.
Any particular technique you're talking about, ma'am? Lakshmi Prasanna, ma'am?
Yeah, how much time you will take for like therapy program?
In the sense, like it depends on the condition, ma'am. It's not like we are giving uh, all treatments together. Like it depends. If the person is having sinus, then we give nutrition or this gluten-free, protein-free diet we give. Or if they have very severe, tinnitus symptoms, then we ask then we give acupuncture treatment. Depends on the symptoms and depends on the diagnosis or the root cause of the disease. I mean, root cause of the tinnitus problem.
Yeah, I'm asking minimum duration of your treatment, like 1 month or 2 months, 3 months. How much time it will take?
No, ma'am. Usually we suggest for to come them for 10 sessions. By 10 sessions, there will be a symptomatic relief. Okay, like by the time we'll teach them, yeah, these are the lifestyle modifications which you should do, and like how to reduce their stress and anxiety. We'll teach them how they can sleep. So 10 sessions are enough, ma'am. That is more than enough.
So we have a couple of other questions in the chat box. So the other question was, would the ultimate goal of yogic and naturopathy treatment for tinnitus be habitation itself? If so, how is it different from sound therapy, tinnitus retraining therapy, and cognitive behavioral therapy?
For tinnitus rehabilitation. Okay. Sound therapy, tinnitus retraining therapy, and cognitive behavioral therapy, and this yoga nidra is almost similar. And sound therapy is the person is exposed to some white noise or pink noise for a particular duration. So it is different, ma'am. Like compared to naturopathy, it is different. And tinnitus retraining therapy, I am not sure about this, so I won't comment on it.
You said you will cover the various acupuncture points at the end of the session.
Yeah, ma'am. Yeah. My video is on, I guess. Can you see me?
Yes, yes.
Okay. So one point is exactly in front of this ear and in between the temporomandibular joint is there right here. When we open our mouth, we can feel a slight depression here. Can you feel it? Exactly in front of this. Yeah, if you can feel, just tell me. Yeah, so that is one point. We can, if we are giving acupressure, we can give that pressure stimulation for at least 10 minutes or 10 to 20 minutes. If there is no that equipment with you, we can use this pen tip also. That this is enough. This is enough. There is no need of hi-fi equipment. Okay. Then there is one more point called it is located right under the ear at the starting of the sternocleidomastoid muscle, like here. Can you see? Under the jaw, at the starting of this muscle. Here there is one more depression. This is one more point. Or, ma'am, I'll share this information with you so that you can share it in your groups.
Sure, definitely.
So instead of showing like this, that is better.
So any other questions from the participants? Krishna sir, would you want to add any of your inputs?
Nothing much, but yes, as Dr. Abhinaya said, there are various natural therapy techniques which are available. We definitely are, as an audiologist, we are not competent enough for it. But when as I was telling, if you think the patient has a lot of anxiety issues, a lot of psychological issues, and there is some source of nerve related one, especially the point now which you were showing. They are more related to TMJ joint and these areas. Those muscle related tinnitus can also be one of the reasons. Okay. TMJ muscle joint. Now, if we suspect those kind of things, then this could be one kind of mode of treatment which can be referred to, and they will take care of it. Okay, they are the experts on it, and they can take care of it. If sound therapy, like what we do, and what they do, or cognitive therapy, it can be complementary. It may not be the sole one. So we can be working on our one, but this can be complementing to each other. And because the way naturopathy and Ayurvedic, all these things, the way they look at it, and the way these conventional medicine or current allopathic one looks is different. So we can complement each other, especially this all becomes very essential when we are not really sure about exact causative factor, or there are multiple factors that are contributing for the tinnitus. That I would like to tell everyone to be thinking. Don't be restricted, say that you are the best, you are the only one, only your mode of treatment. There are, yes, a number of treatment options are available. Each individual is different, so we are not sure. Ultimately, all our goal is patient's benefit. Okay, so we should always facilitate that and make sure that the patient, who gets benefit with whatever treatment it is. Okay.
Thank you so much, sir. So I hope with this we have come to the end of the webinar. I would now like to invite Honorable General Secretary Gopi to share vote of thanks.
Good evening, sir. Krishna, sir. Hi, sir.
Good evening.
Hi, sir.
Hi, good evening.
On behalf of APASLPA-ISHA, I sincerely thank our esteemed speakers, Dr. Y. Krishna, sir, and Dr. Abhinayasri. Sir, your talking was amazing and out of the box, sir. Thank you so much, sir. I heartfelt thanks to APASLPA-ISHA members and our wonderful participants for making this webinar a success. Thank you, one and all. And in future also, we are planning these type of webinars in every awareness weeks or awareness programs. Thank you very much.
Okay, so I think this we can close the webinar. I thank all the participants for making it for the webinar today. So we'll conclude the webinar. Thank you.